Hello, I am Dr. Jerry Cruz, the Dean and the Provost of SIU Medicine. Today I will discuss our ongoing commitment to human rights, to equity, to diversity, and to inclusion here at the School of Medicine and across the entire SIU Medicine enterprise. It is essential to me that everyone at SIU is valued, supported, and safe in our academic and practice environment. It's also important to me that we at SIU Medicine take a leadership role to promote the values of equity, diversity, and inclusion in the communities to which we are accountable. Over the years, SIU Medicine has achieved excellent diversity in our student body, faculty, and staff. For example, in national reports, we are ranked highly for the racial diversity of our student body and for the gender diversity of our faculty. This performance is commendable, and I thank those now and before who have promoted this diversity. Our Med Prep program and our admission and search committees have actively provided us medical student, resident, and faculty candidates who represent the great diversity of our region, the nation, and the world. But this is really not enough. These are just numbers, raw data, and statistics, which may or may not reflect the relationships that truly promote equity, diversity, and inclusiveness, particularly in these difficult times. At SIU, we value diversity, cultural, religious, ethnic, gender, and lifestyle. We value inclusiveness, and we respect all opinions in our daily work and in our vision for the future. And above all, we value equity. Equity, by its essence, expresses an inherent fairness and justice. But unfortunately, all of us know neighbors, patients, staff members, learners, faculty members who have experienced unfairness, injustice, and inequity. Our historical and present foundation of equity likely will be put to the test in the circumstances that face us right now. Fortunately, at SIU, we already have a rock-solid policy regarding these issues. I will quote an excerpt from the official SIU Carbondale policy on non-discrimination and non-harassment. Quote, "It is the policy of SIU that all students, faculty, staff, and guests should enjoy and work in an environment free from discrimination and harassment. Discrimination against any person or group of persons based on race, color, national origin, ancestry, religion, gender, sexual orientation, marital status, age, physical or mental disability, or military status is specifically prohibited by the SIU community. We are committed to maintain an environment in which ideas are pursued free of intimidation or fear. This applies to admissions, employment, access to and treatment in all programs and activities. Harassment of any kind is strictly prohibited." End quote. These are strong words, but this is a correct, fair, and just policy by which we must abide. These are the attitudes that will help us care for those who are most vulnerable, help us train the next generation of culturally competent physicians and physician assistants, and help us fulfill our own triple aim plus one: healthcare, medical education, research, and personal relationships that are effective, efficient, equitable, and enjoyable. We must adhere to our behavioral standards. Each of us must accept and respect those who differ from us. Plainly stated, the administration, faculty, staff, and learners of the SIU School of Medicine will not tolerate racism, xenophobia, homophobia, misogyny, or any other such bias. This is an active process. We must respect and value our varied experiences, backgrounds, and knowledge. We must listen to each other. We must learn from each other. We must speak up for each other. We must support each other. And, as part of our mission, we must be leaders and extend these attitudes and actions beyond the walls to the communities and people we serve. And now, we will build on our historic commitment to equity, diversity, inclusion, and cultural sensitivity. In 2001, we established the Office of Diversity and Multicultural Affairs. Over the past 15 years, under the leadership of Associate Dean Dr. Wesley Robinson McNeese, we have successfully increased the number of students, residents, and fellows, faculty members, and staff members who are underrepresented in medicine. For our medical students, we have been successful in providing the academic and personal support that assures their growth as a physician, their graduation from medical school, and their successful attainment of future professional goals. Over that time span, we have also developed an organizational culture and instituted many programs that have helped us meet these goals. Here are some examples. Our P4 pipeline program supports healthcare career development for high school students. Our Med Prep post-baccalaureate program groom students from underrepresented groups for careers in medicine and dentistry. Several community-based educational programs support health equity. Examples include the Eastside Health Initiative and the Enos Park Access to Care Collaborative. Healthcare education in urban underserved areas is supported by educational experiences in the Metro East area of St. Louis. Institutional awareness is enhanced by our Diversity Week and by the new Alonzo H. Kinnebrew Forum. This year, Dr. McNeese has taken a new position in the SIU system as System Executive Director for Diversity Initiatives. At SIU Medicine, we have begun the process to name a new Associate Dean of Equity, Diversity, and Inclusion. We will build on the success of the past and institute several new strategies to expand our effort. These strategies will reflect our organizational commitment to the principles of equity, diversity, and inclusion. We will commit to train a diverse and inclusive healthcare workforce. We will commit to have a diverse and inclusive staff, faculty, and student body. We will improve our collective cultural competence. We will engage our community partners to eliminate inequities in healthcare access and delivery and to reduce disparities in healthcare outcomes. Engagement of our community partners will occur in a group whose name will reflect the issue that it will address: race, racism, health, and healthcare. In modern parlance, R2H2. And as an organization, we continue to address systemic racism. In March, 45 members of our SIU Medicine community will engage in a 3-day seminar led by Crossroads and sponsored by SCOTR, the Springfield Coalition on Dismantling Racism. We have already started this process with smaller groups before. These forums will allow us to share feelings, express concerns, process current events, develop a system of mutual support, and discuss the SIU role in community leadership for issues of diversity and inclusion. As these efforts illustrate, it's now time for SIU to lead the community forward in issues related to equity, diversity, and inclusion. We are primed to expand our work for a diverse and inclusive healthcare workforce, to improve the cultural competence of our learners, faculty, and staff, and to accelerate collaborative work with community partners to eliminate inequity in access and delivery of healthcare, to reduce disparities in outcomes. I am proud of all of you in the SIU Medicine community who move our work in equity, diversity, and inclusion forward. Thank you.